Welcome to the office. Welcome back, Sumit. We've had a few visits though, right?
Yeah.
We've had a couple of visits.
Yeah.
How's the back doing?
Back is better. It's less stiff, but it does get fatigue through the day by evening or something.
Less fatigued or same fatigue?
I think fatigue is same. It's still better in the morning,
Okay.
which was actually reverse earlier.
Okay.
But
So it's better now when you wake up in the morning,
Yes.
but obviously as you're using it more and more throughout the day, you're
Yes.
getting fatigued at the end of the day. Okay. Anything new show up?
No.
Okay. And you're here for your low back number 1?
Yep.
Right? All sided pain?
Yeah.
How is the shoulder, neck, everything?
Neck is not as better as back. But I don't know whether it's because of the way I'm sleeping or something.
Okay. Why don't we check you?
Yep.
And then if you have any questions, we continue on.
Yep.
Sound good? You ready for more?
Yes.
All right. So what we started on with Sumit is this S5. And if we look over here, we know that we have transitional vertebrae here at 5, and 4 is starting to calcify in the back here. So our goal here is number 1 to get the foundation right, and number 2 to start to work on this segment L4, L5 and try to get some mobility there. We may be talking about some other interventions in addition to the adjustment down the road, okay?
Yep.
And more importantly, because you don't live here, you're visiting here. So we'll need to find something for you to continue on. Okay?
Yep.
All right. Let's take a look and see where we're at today. Starting at the base, goes to the right, goes to the left, and breaks right up top. C1, C2, left side. T6, 10 points, left side. Let's see how this back did. We're still down low, okay? S5. We also have the left pelvis that we need to deal with, and when we look at it, we have a measured difference left side. The left hip is 7 millimeters lower than the right, and correcting his left pelvis, which is down and out, will correct 3 of those millimeters. Today we're going to do something a little different. We are going to do his left pelvis with S5. 5, 1, 2, 3, 4, 5. Still there. Okay. Back slowly. 4. Still there, yeah? Left pelvis, come back slowly towards me, all the way back, all the way back. Top of the joint, middle of the joint, bottom of the joint. More tender there. And that's consistent with the PIEX. It's gone down, so when that pelvis goes down, the swelling and edema is going to be on the top part of the SI joint. Right side, come back slowly towards me. Middle of the joint, bottom. So we're going to do that coccyx S5 on the right side, and then we're going to do the pelvis on the left side for him today. Let's do static palpation and feel what's going on here. Head down, please. 1, 2, 3, 4, 5, 6. Bunch, 5 or 6. 5, S5, left pelvis. Let's check the top. 6. Motion palpation. First part of motion palpation when we're looking at the cervical spine, right there. 7, 6. We're doing flexion extension because the first way it's going to misalign is going to be posterior or back. Then it can wedge right or left. His is on the left. Turn left, and it can rotate one side versus the other. So he has that right rotation restriction with the left wedge on motion palpation. If we go over to his C6, listing on the x-ray, we'll see if it matches. And if we look at this 7-6, he has a left wedge and a right rotation restriction. So it's a PRI. So patient matches the x-ray. Kind of cool, huh? But the break was up top. Tender there too. Right there. But not as bad. So here's what I want to do. So we're going to work on the mid and low back. I'm going to have you walk after, and then we're going to see. That C6, I should be getting that pressure on the meter. I'm not getting it on the meter, but that's where it's starting. Okay? So maybe something is masking from upper cervical. You ready for me?
Yeah.
Come on, let's do it. T5 is going to be a PRS, posterior right superior. And the Gonstead work, we have what's called a static listing system. Tells us the static malposition of the vertebrae, which will also tell us which way to correct it. 1, 2, 3, 4, 5. Get the tissue out of the way, get right on that spinous. Oh, home run. Beautiful. Very nice. Let's walk that off once, please. And let's do, okay, so we're going to do the sacrum S5 first. We want to do left side down. So let's go left side down. Head over here facing me, please. Thank you. Bottom leg straight, top leg is bent. 1, 2, 3, 4, 5. So, Eduardo wants to go. We're going to do this as a finger push. So we're not going to crank it down like this. We're going to push it in like that. We need to get right at that joint. And there it is. Hold on. Okay, let's walk that off once. And then you'll go right side down. We'll do the pelvis. Pelvic adjustment is a new friend. Chala. Come forward, please. Slide forward a little bit. Bottom leg straight, top leg bent. And I just want to demonstrate exactly what we're doing here. Here's his spine. Left pelvis has gone down and out. It's gone down and out. Referencing the PSIS to the sacrum. Down and out, so we want to push it up and in. Okay? Cool. One of the big misconceptions out there is people thinking that you need to crack both sides of the pelvis. Tuck forward. What Dr. Gonstead found is only one subluxates, the other one compensates and can produce tightness of the ligament. So you can get pop crack sounds, but it doesn't mean that it needed to be adjusted. And there is a special case where both actually do get subluxated. I think I've had 2 in my career. PIEX. Now, it's not this. It's push. Push P to A and torque. Hi. Let him roll. Home run, baby. Come on up. Let's walk it up. Alrighty. Have a seat right over here, sir. Deep breath in, blow it out. Head down, please. Of course that's the 6 showed up now, didn't it? So now 6 showed up and that upper cervical is gone. Scoot forward, please. And back. And the question is, why is that? That's a damn good question. Right hand up. I think it was just the tightness of his upper neck that he gets was masking it. Head, hands down, please. Good. Shoulders back, sir. Feet all the way out. Okay, PRI. From the spinous, coming right off to the lamina. Chin down. Sumit, you're learning too, right? So for PRI lamina, we want to turn the head to get rid of that rotation, and it has to go through the left eye. There it goes. Nice. Walk it off, sir. And have a sit. Okay. We got lots of walking to do today, okay? Neck is clear, mid back is clear. Do 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 do. We got heat. Low back is clear. Let's feel. Sit up straight, all the way back, sir. I need to get to this one. 4, 5, all the way back, please. Good? Different?
Yeah.
Okay. We're all set there. Let's continue. Let's set the shoulders. Sit up straight, please. And the ears. Right shoulder. There you go. Left shoulder. There you go. Let's go on your back over here, please. Questions for me? We're going through our process while you're here. Relax the foot. Left leg up. Back on the chair, please. Let's buff out the back. Squeeze, squeeze. Elbow and wrist. Radial head. Posterior distal radius. Posterior lunate. Posterior lateral scaphoid. One more. There. Squeeze. Elbow still off. Right there on the inside. Come towards me a little bit. We're going to do the ulna. There you go. Go like that 5 times. Squeeze this in first. Squeeze. Okay, you got homework here, okay? You're not lefty, right?
Nope.
Okay, rubber band. Basic extension exercises. This is something very simple everyone should do, especially on a computer, and especially today using phones, right? So we're all in flexion. We're all in this position using our devices. We're going to work the extensor mechanism, which is the extensor muscles of the forearm. Easiest way to do it is keep your hand in neutral, slight extension, and you're doing opening it up with the rubber band. Okay?
Yep.
And we want to do 50 each hand. Keep the band close, close to like the second knuckle for now. Yep. Open and close. If it's too hard that way, go to the first knuckles or the PIP. And the idea is to keep the fingers straight. As it gets easier, you go to the nail beds. Okay?
Got it.
That's your homework. Very simple. Okay, my friend?
Yes.
I will see you tomorrow.
Yes, tomorrow.
All right? And if you have any questions, you let me know.
Will do.